Coccidiosis is also really commonly referred to as coccidia or cocci, and we see it most prevalent amongst baby chicks, usually most prevalent amongst baby chicks who have just been put on the soil. Coccidia is a protozoan parasite that attaches to the gastrointestinal tract of our chickens, and you'll find that coccidia is actually present in most soil, and it's already present in the gastrointestinal tract of most baby animals even. I've seen coccidia in my dogs, I've seen coccidia in my kittens, I've seen coccidia and goats. It is just everywhere. It's just something that we have to learn to manage. What we hope to happen is that our baby chicks become exposed to coccidia in small amounts over time. That gives their immune system a chance to respond appropriately before we see any negative consequences. However, this doesn't always happen. And what many chicken keepers will share with you is that in our chicks who have hatched underneath broody hens, so if I hatched chicks from eggs that were laid on my soil and I use a broody hen to hatch those chicks, I have never once seen coccidia in a chick hatched under those circumstances. And the reason for that is those embryos and that egg have gained some immunities from its parent stock, and then while that egg is developing underneath the broody hen, it's continuing to build immunities to the things in the soil, coccidia included, and also from that mama hen who's brooding, and as a result they are less susceptible to those negative consequences from coccidia once they hatch. I have actually been reading a lot lately about how immunity can be built within as few as 2 to 5 generations of chickens. In my experience, it has been very uncommon to really see negative effects of coccidia in a brooder, but it's not impossible. And the reason is because it is present in the gastrointestinal tract of our chickens, and it thrives in wet, warm environments. And so sometimes as chickens are like pooping in the brooder and the brooder's getting messy and they're pecking around, they'll pick it up through the dropped feces inside that brooder. As a way to help build the immune system and to encourage the chicken's immune system to create natural immunities to coccidia, some breeders will do things like put a little bit of soil from their property inside the brooder as the chicks are growing to expose them to small amounts of the parasite as they're growing up in more of a controlled setting. What I have found is it's usually once I expose my baby chicks to the soil that I may then see some negative consequences. Telltale signs of coccidia are blood and stool, although that's usually a very progressed sign, and by the time there is blood in the stool, severe treatment is needed immediately to prevent death. More often than blood in the stool though, what we'll notice is that chickens are lethargic, they're not eating and drinking, they have a classic sort of telltale, we call it like a vulture pose, where they're sort of puffed out, wings up around their neck, and they'll just look genuinely very, very uncomfortable. Seems like younger chicks are at a greater risk, so like under 16 weeks is typically when I expect to see these symptoms in chickens, if I'm going to see them at all. It also seems like summertime, when temperatures are hot, moist weather tends to be where coccidia thrive. But the treatment is really simple, it's really effective, and it's very inexpensive. You can buy Corid over the counter at any feed store or even on Amazon. You can buy it in this liquid form, which I prefer, or you can even buy it in a powder form. But I feel like the powder form, when like it's open and moisture gets to it, it like sticks together. And I just think the liquid form works better. And get ready to screenshot, because here is the dosage chart that we seem to agree upon that works. You'll notice that there is a moderate and a severe dose here. The moderate is what we use when we want to treat preventatively, when we think that there may be a problem, but there's not necessarily blood and stool. We just want to be proactive. And severe is the dosage that I would use if I for sure know that I'm dealing with coccidia, whether I've had a fecal test done or I'm noticing blood in the stool. The active ingredient in Corid is a chemical called amprolium, and amprolium actually works by blocking B vitamins. So throughout the course of Corid, we want to be sure that we're not using any medicated feed, because the active ingredient in medicated feed is also amprolium, and we don't want to do any vitamin supplements during the course of treatment. In fact, we want to make sure that there's nothing else in that water other than the Corid, and that water with the Corid mixture in it is the only water that the chickens have have access to throughout the course of treatment. Once that treatment is over, it is a totally fine idea to give a vitamin supplement or maybe even a probiotic, even maybe some like organic yogurt, apple cider vinegar to help them restore that gut flora. Corid can sometimes be a little bit tough. There are breeds like Silkies that are a little bit more predisposition to vitamin deficiencies, and that's just something to be mindful of, although I haven't actually seen any negative consequences in my own flock. You'll also want to be sure that you're mixing a fresh batch of that Corid and water every day. Unfortunately, once life starts to be lost as the result of coccidia, it seems to happen really quickly, but also once treatment starts, the Corid seems to work really quickly. I'd say within a day or two. Corid is a #1 must-have on-hand medicine that I always keep in my medicine cabinet for my chickens.